Now we're at 7:52 News Extra, brought to you today by First State Bank. And here's Kevin Mooney.
Thank you, Dennis. Good morning, everyone. Very pleased to have Dr. Omar Jimenez here from Regional West Medical Center. I mentioned at the end of the news at 7 o'clock, one of the best neurosurgeons, not only in this region, but in the country. And
thank you, Kevin. That's pretty kind.
Yeah. So personal experience here, and he's done a good job with me. And playing golf and doing all kinds of other stuff. So
thanks for having me.
You bet. No problem at all. All right, so we want to talk. You've been here now quite a while, right?
About 7 years now.
Yeah. And kind of explain how you got here, how they recruited you.
Well, it was a great opportunity. The hospital made me an offer I couldn't refuse, and here I am, 7 years later.
Yeah, and a booming practice.
Certainly have.
Yeah.
We're open 24/7, 7 days a week.
Well, you were working at midnight last night, right?
Yes, I was. Yeah, very busy.
Yeah, so you're very busy. All right, so let's talk about the type of surgeries you do. You do a lot of non-invasive surgeries, right?
Well, we do what we call minimally invasive operations, meaning that we perform these operations through small incisions. Typically, a lumbar discectomy incision is about an inch or so, or even smaller.
Yeah.
And we can also perform complex operations through different avenues, either the front of the spine, the side, or even the back. And these operations minimize the blood loss, allows patients to recover faster.
Yeah. And that was kind of what I had. It was pretty small and pretty non-invasive, and you go through rehab and you're ready to go.
Absolutely.
And so you have a physical therapist there at the office.
Yes, we have a comprehensive spine center, meaning that we provide not only pre-op care, rehabilitation services, pain management, including medications, injections, etc. We also have other specialists who are pain physicians that perform non-invasive procedures, and our patients will go through many weeks of conservative care before having surgery. But the fact that we have a comprehensive center, we can offer our patients a spectrum of treatment. So physical therapy, injections, and eventually surgery if necessary.
Okay. When somebody comes into your office, kind of explain the procedure you use to determine whether therapy is the right situation for somebody or whether they need to go through some surgery.
Well, we typically start with a history of the patient, try to understand what's causing their pain or where exactly the pain is. Then we evaluate X-rays and MRIs, and based on those images, if the patient has something that is not life-threatening or perhaps limb-threatening or neurologic threatening, then we would consider conservative treatment and start with physical therapy. Every patient would require some form of therapy before having surgery, unless, as I said, it's an acute problem. But the combination of history, MRIs, X-rays, and having failed conservative care, that's how we make decisions. And eventually, usually it takes anywhere between 6 to 12 weeks before making a decision about surgery.
Yeah.
So we're very conservative.
Yeah, conservative, long time before you actually decide one way or another.
Absolutely.
All right. We'll take a break and we'll be right back.
Buying a home is the investment of a lifetime. We know the
Talk
local
about the
market.
fact you do it in addition to
We see that you get the right
spinal surgery.
Stop by and see us. We're
and
Eagle
other
House
stuff
Lending.
as well.
First State Bank, member FDIC. We're big on you.
So you've been doing this for how long now?
This is 30 years here, 4 years in Torrington, another couple of years in another station on the eastern end of the state, so 35 years. Long time. All right, we are back on News Extra. We have Dr. Omar Jimenez here, a neurosurgeon from Regional West Medical Center, and we're discussing exactly what he does, and he's even looking at possibly adding on a little bit, maybe somebody to your practice.
Very, very soon, hopefully in the next few months to perhaps a year or so.
Yeah.
I wanted to just also mention some of the other things that we perform just before we went on the break. We also do sort of as close as you can get to navigational surgery in the spine and also in the brain. We have special devices that allow us to keep patients safer because we form three-dimensional images of the spine and the brain, and with those images and computer navigation, we can perform these bigger operations in the spine and the brain, keeping patients safer and also losing very little blood. So I failed to mention that. Wanted to bring that up.
All right, and the one thing with, you know, at least when I was working with you, is that you always explain exactly what you're going to do, right?
Correct. Yeah.
I mean, people know these are your options, these are your choices,
Right.
and what is, you know, this is what I recommend, but it's obviously their final choice, right?
Absolutely. At the end of the day, as the patient makes the final decision, we present the sort of the landscape of options, and then obviously give you informed consent on what we do.
Yeah. Okay. So you mentioned the brain surgeries and some of the other things, and like you said, how many days do you perform surgeries?
So we operate at least 4 days a week, and I hold a Tuesday clinic, which we're there all day, and every other week I have clinic in North Platte, and we see also a fair amount of patients from the community.
Mm-hmm.
All those patients have surgery at Regional West. Here we offer sort of the modern equipment that we need for these operations. We also perform intraoperative monitoring to keep the patient safe. We can sort of give feedback as we operate on these nerves to make sure that we're keeping them safe. So all that equipment is here at Regional West. Hence, you know, we perform surgery only at our center.
Okay. And you have folks coming from a long distance here, right?
Yeah, we have patients from, as far away as Lincoln, Nebraska. I've taken care of some Omaha patients. And usually they're family members, for example, patients that live in the area and have had surgery with us and they're happy with our care. And even patients in Wyoming, quite a bit actually, and even Colorado as well.
All right. All right. So a booming practice, and so if you have a need and you have some back pain and you're thinking, I've dealt with this long enough, and maybe it's time to kind of look at some options, Dr. Jimenez is available at Regional West Medical Center. What's your office number there?
630-1947.
Okay. All right. Very good. Thanks for stopping by.
Thank you.